My name is Catherine Keatsman. I'm the director of the Health Equity Challenge and the Health Equity Program here at the UCLA Center for Health Policy Research. I'm also an associate researcher in the Department of Community Health Sciences at the UCLA Fielding School of Public Health. And we're so excited that you're here with us today and are interested in learning about our third Health Equity Challenge. Before we get into program details, I'm very pleased to first introduce Dr. Ninez Ponce, Director of the UCLA Center for Health Policy Research and Professor and Chair of the Department of Health Policy and Management at the UCLA Fielding School of Public Health. And she's going to share a few thoughts with us. Dr. Ponce?
Thank you so much, Dr. Keith. Can you hear me? Okay.
Yeah, you're doing okay.
Okay, sorry, I have to join by phone, and I'm in another conference right now, so apologies. But good afternoon, and thank you for coming today. I'm Ninez Ponce, and I'm the director of the UCLA Center for Health Policy Research. I'm also a professor and chair at the Department of Health Policy and Management at the UCLA Fielding School of Public Health. I just want to take a moment to welcome the UCLA graduate students joining us today at the Health Equity Challenge information session. You know, in a very difficult era where health disparities persist and access to quality healthcare remains uneven, to say the very least, it is crucial that we come together to address these issues. And we have full confidence that our UCLA graduate students can address these issues head on. When we first set out to launch the Health Equity Challenge, and again, I thank Catherine, Dr. Keatsman for the innovation and taking the charge on this. She had a vision, and we supported her at the Center for Health Policy Research. Our vision is to support our future generation of health equity leaders, such as yourself, in your pursuit to build a healthier and more equitable world. So in just a few years, we've seen 24 student ideas become full project proposals. 6 projects have been funded, and $300,000 has been awarded to community organizations, the partners of students, to implement the student projects. So your ideas and proposals are exactly what our communities need. They need people like you to amplify their voices, to think creatively about the world's greatest challenges, to co-create and build solutions. And you then will inspire the next generation of innovators and problem solvers. So I'd like to take a moment to thank Dr. Keatsman again, Director of the Health Equity Program at the UCLA Center for Health Policy Research. I also want to thank Dr. AJ Scheitler and Tiffany Lopes, our Health Equity Challenge team. There are many of us at the center that are kind of in the background supporting, from the logistics to admin to IT. We are all so excited about this program. The Health Equity Challenge is more than a challenge, more than a program. It is a commitment to creating lasting change in our communities. So I thank you, and I give it back to Dr. Keats.
Thank you, Ninez. Dr. Ponce, so much for pinpointing exactly why we believe in this program and recognize its importance, not only to our Center for Health Policy Research, but for all the communities that we strive to serve and recognize and connect with through the important work that our students are poised to do. So we're very excited to be able to do this a third time, and 3 times is a charm, and we're going to get into some of the program details now that I'm imagining that most of the students attending want to hear about. And we're going to share some general information about the challenge, the purpose, again, the overarching goals, and then more detailed information about the application process, the review criteria, and the specific components of the program that we've put together. And as we go through the session, please jot down your questions. You can put them into the Q&A, which most of you will find somewhere on your screen. Mine's sitting at the bottom of my screen. I think it depends how you're set up, but please do put your questions in there. We're going to leave most of the time to talk about this program and answer specific questions that you may have. Okay, so many of you may have seen this flyer or something that looks like this, and that's why you knew about the program. And maybe you heard about it through some former student participants, but here you are at our information session. We are recording it so that you can go back to this afterwards. You can share it with colleagues and friends. And speaking of colleagues and friends, I want to start by more directly introducing two exceptional colleagues who I've had the great fortune to work with here at the Center for Health Policy Research. And now for a third time, we are co-leading this program. So please join me in welcoming Dr. A.J. Scheitler, who serves as our center's Director of Development Engagement and Strategic Planning, and Tiffany Lopes, our center's Director of Communications and Publications. AJ, would you like to say a few words to the students?
Sure. Thank you. I am very excited to be back for this third year and hope that you all are excited about this fantastic opportunity. I hope you've looked through some of the past projects that we've had, because there are some exciting ideas and I hope it's really stimulating you guys. As Dr. Kiesman mentioned, one of my hats that I wear at the center is to work on development projects. And so I will be happy to, during this process, get with you guys about how to put together a winning proposal, how to improve your community engagement, and really come up with turning the ideas that are in your head into really great ideas on paper that we can sell to other people. So thanks everybody for joining, and I look forward to working with you over the next several months.
Thank you, AJ. Tiffany, welcome.
Hello everyone. I'm really excited to get to know you all, walk you through some of the aspects of the Health Equity Challenge. We're really excited to have you, really excited to be back for a third year. You can read more about previous projects on our website. I will be helping you with any communications needs you have throughout the program for those who are selected as finalists. So helping you with blogs, helping to promote the projects that you're working on. And I'm really excited to get to read your applications.
Thanks, Tiffany. I feel very grateful to have such incredible co-leaders of this project. Tiffany being an expert in communications, all things communications, and AJ an expert in proposals and grant writing and development and strategy. And so the brains that they bring to this and the assistance that they're able to provide are really remarkable. Oh, I should say that I have posted everybody's bio that you've met to date. It's posted in the chat. So if you want to read more about us, please feel free. That information is there. So there are many definitions of health equity, but I think that this description provided by the Centers for Disease Control and Prevention really set up the discussion today for our purpose and the goals of the Health Equity Challenge. So the Health Equity Challenge is really looking to you, our future leaders, to come up with innovative ways to ensure that the opportunity to attain one's full health potential is realized, and to eliminate disadvantages to achieving this potential due to the social position or other socially determined circumstances. So through this program, we're really asking you to identify a health inequity to be addressed. And examples might include increasing access to health and social services, enhancing quality of care, improving healthcare outcomes, and especially among historically disadvantaged populations. As you come up with your innovations, we're hoping that you'll think very broadly and creatively about where health takes place and where equity interventions can occur. For example, you might have ideas about urban parks and how you can use the design of urban parks to promote community health, Or you might have ideas about transportation innovations that can improve access to health and social care. We encourage graduate students from all disciplines across UCLA to apply to this program because we believe that innovative solutions can be crafted from a broad range of societal sectors and institutions. And we believe that creativity is often fueled through multi-sectoral collaborations and by the application of multidisciplinary frameworks and perspectives. As has already been mentioned, you can learn more about last year's winning projects and even the current year's, the first inaugural year of the Health Equity Challenge. You can find out more about those projects on our website. But last year, for example, there was a program that used trauma-informed yoga services, mental health services, and educational workshops to promote healing and wellness for South Asian survivors of interpersonal violence. Another program was an extreme heat preparedness and response training for caregivers. We also had a community health worker training program to address climate-related health risks among American Indian and Alaska Native communities, and a mobile health screening protocol for vision-threatening conditions and eye safety training for day laborers who often encounter hazardous working conditions. So as you develop your applications, we expect that you will advance ideas that can support community-based programs, policies, campaigns, or interventions that address a current health equity issue that you've identified. In terms of the geography, the programs that you dream up can be located in Los Angeles, San Bernardino, or Riverside counties. We encourage you to focus on implementing programs that can serve an under-resourced area and underserved populations. And it's important as you think this through that the program ideas that you come up with can be implemented for an award of up to $50,000. That is the maximum amount that the community organization that you partner with would be awarded. So it's important to be practical. As you dream up the biggest solutions to the biggest problems, you also have to find a way to hone in on a specific, very doable, viable intervention. So I think I've already covered this slide. So in terms of the eligibility, you're eligible to apply to this program if you are a UCLA graduate student from any school or department. This means you're currently enrolled in a UCLA graduate level academic degree granting program. You've seen the materials, but just to repeat, the 2-page application is due by November 6th. It's a Monday, that's 2 weeks from today. From these applications, up to 15 students will be invited to develop full proposals and participate in the 15-week program. The finalists will be announced by mid-December, right before the end of this year, at the end of this quarter, in fact, towards the end of the quarter. And then the actual program, mentoring program and training will begin in the winter quarter, January 8th. It'll continue for 15 weeks through April 26th. Which is when your final full proposals will be due. So you can access the 2-page application at our healthequitychallenge.com website. There's a simple form. You fill in your basic description of your name and contact information, the program, the department or school that you're in. And then there are a couple of open-ended questions. We want to understand your vision for participating in the program. We want to hear your aspiration, like why are you committed to reducing health inequities? We want to hear your original ideas for doing so, and then including why you're focusing on a specific health inequity, why you're focusing on a particular population, maybe a specific geography. Through the application, we want to make sure that you demonstrate your independent thinking and sort of separate this from advisors and mentors' existing program or research. We want to hear about the type of innovation you are considering and its expected impact, why you think the innovation you're proposing is going to make a difference, it's going to make a change. We want to hear if you have ideas for who your community partner might be. You may come in with already a solid community organization in mind that you know would be the perfect place for your idea. But you might also not really know where your idea can be implemented. And the program staff, we are here to help you with that. The application also asks you to name a potential mentor, or if you have one that you're clear that you want to be your mentor or advisor, then you name that person and provide their contact information. One thing that we'll share on this note is many of you already have academic advisors, and many of you have pre-existing mentors. We would encourage you to think about identifying additional mentors, because everybody comes with different perspectives, different areas of expertise. So think about a mentor that really would help you with this particular program after you learn a little bit more about it. And then finally, we'll ask you to upload your CV or resume to the application portal. You'll notice in the application that there are suggested word lengths for each of the open-ended questions we ask. So don't overlook those, keep an eye out for those. That's, sort of roughly parallels how the responses are weighted in the review process. And then note as you fill this out that this is not a savable application. You cannot return to it once you start it. So you may want to go through the application, complete your answers on a separate document like a Word doc, and then cut and paste them in. And then of course you can easily get your word count in another document format. Just paste them in into the application. We have had a few issues at times. There may be a little glitch when you finally get to the submit button. We've tried to make it very clear, clearly spelled out there. Wait a minute after you press submit. It's kind of like a little, it might be a little delay before it goes through. You might get an error message. Wait for a little bit and try it a second time. If you continue and then again, wait, give it 30 seconds, 60 seconds to get an okay message that it was received. We're trying to work this through, and hopefully it won't be an issue by the time you get in there and submit your application, but just giving you a heads up. If you still have trouble and you're not able to submit, obviously reach out and let us know, and we will figure it out with you. So the applications are due November 6th, 2023. The review process happens outside of UCLA, so none of us review. I mean, we'll read all your applications. I'll be very clear about that. We want to know what it is you're coming in with, but we have an independent review committee, and these are the panels comprised of state and local leaders in health policy. These are program executives and administrators, and they have a deep understanding of community health and health disparities. So they will be the ones reviewing the initial applications and then the full proposals for those who are invited as finalists. Again, up to 15 will be invited to compete in what we call round 2 with the announcement mid-December. Sorry for the repetitiveness, but if you're anything like me, I need to hear things more than once. Okay. I imagine you'd like to know how your applications will be reviewed, how they'll be evaluated. So we put together sort of the 4 major constructs that you should keep in mind as you develop your application. And they include clarity of purpose, originality, potential impact, and feasibility. So let's take a moment and let's look at them a little bit individually. So first, with clarity, you will want to be very clear about your purpose and your focus, both when you identify a specific health equity challenge and when you propose a community-based solution. Be sure to clearly define the problem and the proposed solution. The proposed solution is really the meat of this. Set it up. Why is this important? But really, the meat of this application and the proposal moving forward is how to solve it. So that is clarity. Originality. So the reviewer should be able to determine that the idea you're presenting is really your own, that you have given independent thought to the health inequity and to the development of a proposed solution. And even though this program is really designed on the foundation of mentorship, The mentoring components in this program are really intended to support the development of your ideas, not to lead them. And I just emphasize this because that can be a blurry line in academia sometimes. You have advisors, you have mentors, you're already working on projects and programs potentially when you come to this challenge and complete your application. We want to make sure that even if you're working within a larger program, you're carving out something different than what perhaps others have already created. So just think carefully about that as you move forward in your program ideas and developing your program ideas. Potential impact, we want to see demonstration of how you believe your idea has the potential to move the needle on the health equity challenge that you've identified. And you'll want to illustrate why you think it is likely to make a positive change, especially for historically underserved and under-resourced populations. Often ideas are the most successful when they are innovative, and they may just take a novel approach to an existing problem. It's perhaps approaching a problem from a different perspective in a new way, or trying out an intervention in a different setting. Those are just some examples of ways that innovation can be implemented. And finally, feasibility. I alluded to this a few minutes back, I believe. It's really important that your idea is also practical. We all like to think when we're solving problems, we think big. The problems are big. But when you're putting together your idea, you have to be sure that the community partner has the capacity and that the up to $50,000 is enough for that organization to take on your idea and implement it successfully. So think that through, what's doable given the resources that are allotted for the community partner. And you also will need to think carefully about designing a program or intervention or using an approach that's responsive and will appeal to your target population. And it's got to be something that they're going to be able and willing to participate or be engaged in. So you really have to understand the community that you're directing your program ideas towards. So some more details, some again repetitious, but up to 15 students from the applicants we receive no later than November 6th will be invited to develop full proposals. Each student who's selected as a finalist at that point will receive a stipend of $2,500. We'll set up a mentor-mentee orientation when the program begins in early January of next year. And then we'll walk you through 15 weeks of mentorship and training. And this includes some virtual office hours, some workshops, some one-on-one. If you need help identifying a relevant or a good match of a community partner, if you need help with proposal development, we have some formal webinars or seminars that we're planning, but we're also available to check in with individually. Mostly, however, the mentor that you select and or that we help connect you with takes on the role of overseeing your proposal development. And that sort of includes all aspects of what you're designing, what the population is you're implementing it with, who the community partner might be. So your primary mentor, as we'd like to call that person, is going to be the real go-to for the nitty-gritty of your proposal. We're kind of in a position to provide some high-level resources, some workshops. We also have developed a health equity challenge library, and which has hopefully you'll find useful articles around proposal development, but also around health equity and intervention development, that sort of thing. Blogging about your health equity program idea. This is a requirement of the program, and it should be fun. Say a requirement, but it's so much fun you get to speak in real human language, not in academic tease or whatever. And Tiffany has great tips and strategies that she will share through communications workshop about how to write a blog. And it's the antithesis of a reference journal article. Thank you. So you can talk about what you have in mind, why it's important, and it's really designed to be distributed largely through social media. So your idea can get disseminated much more broadly. So this is really, I think, of great value, both for writing and communicating, but also potentially for your networking opportunities, both during this program and beyond the end of this program, because your ideas are getting out there, and some community organization may say, oh, wow, I love that. We should try to do that at our organization. So there's a lot of value in the blogging opportunity that the program includes. And then also, as we'll get to in a minute, is a poster creating opportunity, which is another form of communication that is essential as emerging academics, clinicians, researchers. I think all of the above. The poster is a way to in a very concise way sum up what it is you're doing, why you're doing it, why it's important, and how it's going to make positive change in community. So after you go through this 15-week program, it ends with submission of the final proposal, which is due on April 26th, a very specific date. And we have a very specific timelines because we do work with this independent review committee, and we have to plan around their very busy schedules to make sure they have adequate time to review your proposals adequately, so they understand across the board what you're dreaming up, and make their ratings based on what you've proposed. Then we have up to 4 winners who are announced at a final awards reception, which is also a networking opportunity. Again, this is where your posters will be presented by you, and people will be invited to this event who might end up being good professional connections for your careers moving forward. So those 4 proposals that are selected, up to 4 at the end, those students will receive an additional $2,500 stipend. The community partners will receive up to a $50,000 grant to implement your idea. And then you will present this poster at the final award ceremony. And then the winners, up to 4 winners, will monitor the implementation of their idea and create a second blog that reports their experience with the Health Equity Challenge. I didn't mean to jump out of that so quickly. 1 second. Did I miss something besides Q&A? Yeah, I just missed this slide, which just reiterates, I think, everything that has already been said. It's the dates, applications due, the announcement of the people selected for finalists, the program dates, and the final submission, and the award ceremony. Okay, so I think walked through that, and we have time for questions and answers, and already some are posted in the chat. So international student apply for this? The answer is yes. As long as you're a graduate student enrolled currently at UCLA, you can apply for this, absolutely. Can you have multiple mentors that are in different departments? I love this question. Thank you for raising it, because I think I mentioned primary mentor, but we encourage you to develop as many mentors in a network that you need to sort of fulfill different aspects of your professional development and your areas of expertise. So that's very common to have more than one mentor. That said, we want you to name a primary mentor for the purpose, because we have to have one person sort of who's responsible guide person to walk you through this. But we definitely encourage you to connect with others to expand your mentoring network. I hope that answers that well. Does anybody, did Tiffany or AJ want to weigh in on any of that? You good? It's good. Another question. Can we have a mentor that is not associated with UCLA? Thank you for raising another good question. This is why I love Q&A, because the things that I didn't think to put in the notes. So yes, absolutely. And in fact, very important, mentor does not have to be an academic mentor. You can also select a community mentor. You may have enough academic mentors and have all of the intervention design, information that you need and proposal development, but maybe you need to know more about the community perspective. And so having a community mentor may be important to some or many of you. So yes, you can use a mentor outside of UCLA and outside of academia. Question, will my mentor get paid for advising? Not exactly. But we will send them a nice thank you stipend. So there is a stipend involved for the primary mentor in this health equity challenge. We wish we could have them sort of on the salary payroll, but unfortunately, we can't do that. We don't have that sort of funding for this, but we hope that they get a lot. And from feedback from previous mentors, most of the mentors have really had a wonderful time. I think it's fair to say, with this program and, with the students. I'm not even saying with us so much, it's with you guys. They've been engaged in, and I think that the feedback we've gotten is there's been a lot of gratitude for having the opportunity to serve as mentors in this program. We will be kind of setting the guidelines for the mentor-mentee relationship, and that's, I think I made a mention, we have an orientation early in the program to talk that through about what's expected. Given that they're not, funded by the program, it is sort of a volunteer role that they're taking on in many ways. So I think that we have to be realistic with our expectations. And it's, everybody's got a lot of time constraints. So it's a matter of being thoughtful about when you reach out to your mentor, how you use them. Think about judicious use of their time, going to a meeting, for example, being prepared with specific questions or things that you feel you need help with. But at a minimum, I think we're setting a guideline where there should be some interaction, ideally, on a weekly basis. But I don't think, just a check-in. AJ, do you want to say anything about that? Am I misspeaking on that?
No, you're not misspeaking at all. The mentors will be a great help to you with what you need, giving you feedback and helping you hone your proposal, helping you identify an appropriate community group if that's not something that you're already aware of. But they really it's wonderful to have someone knowledgeable to bounce ideas off of. So they play a very important role, and we've had some great ones. So hopefully you all will have a really great experience with that.
Thank you, AJ. So another question here from Alberto about what about multiple CBOs? So the answer to that is only one community organization can receive the funding, the up to $50,000 funding. Some proposals are written, and some partnering community organizations do have other entities that they work with. So it's possible that they then take and make a subaward to another organization. So in that sense, multiple CBOs could be involved. But in terms of directly, just similar to the primary mentor, one mentor is going to be responsible, and one CBO is going to be the recipient of the award and responsible for implementing your idea. What they do then with that $50,000, how much they can chop that up, and they may need to take one piece of that. They may have to reach out and have a consultant do part of that work. And related to this question is clarity about what happens once your idea is chosen and then implemented by a community-based organization. Really, it's up to them to then implement your idea. There's no there's no official continuation of your role. So you're not implementing it for them, unless you decide and they decide that you can figure out an arrangement to help support their implementation of the project. But you cannot be hired by them with the grant money they're given. So just want to, hopefully that makes sense to folks who are listening, but we can talk more about it if you have more questions. That up to $50,000 award, you can support implementation of your project on a voluntary basis. But the $50,000 is for them to figure out how to implement your idea. Great questions, everyone. Thank you. Are there questions coming in the chat? Or are they getting answered? Let's see.
I see one. Can the community group be an association or lawmaker that will propose legislation to change a law that discriminates against disabled individuals?
I'm sorry, you said this is in the chat?
Yes.
Okay.
You might need to scroll all the way down.
Okay, thank you. Okay. I just want to look at it and let it sink in. I don't see any reason that community entity would be disqualified. An association or lawmaker, the only thing is a lawmaker to me sounds like an individual legislator. So an individual would not be able to be funded. But if it were, for example, an advocacy group, which it sounds like that's what you're alluding to, Denise, perhaps, an association could be a community. I think the important thing is that for some of our funding sources, the entity needs to be nonprofit. So that might be one firewall to keep in mind, and to ask us about when you're getting to that stage. Okay.
But if you want to work in the policy space, a mentor can help you come up with solutions to try to understand the role of what a community group might play in that legislative process, and it may all work out. So don't step away from a policy-focused project, but you would need to discuss it with someone who can help you mold it into a proposal that would work for this kind of project.
Thanks, AJ. That's good feedback and advice. Okay. I take it, Janice, that maybe that helped that answer. So good. If you have other questions that come up, don't hesitate to chat away, or Q&A away, or follow up with us with an email, whatever's most comfortable. Other questions? We can also open, you can also ask verbally if you don't want to write a question in the Q&A box. So I see a question. I guess it just maybe just came in. Thank you, Supraja. I'm not sure if I'm pronouncing your name right. Apologies if I'm mispronouncing. Do you think finding a CBO is the most challenging part of the challenge? Are there possibilities for our proposal is accepted as one of the finalists, but it's being difficult to identify a CBO who could implement the program? Does the center follow up with the CBO about program implementation after the grant has been provided too? Okay, so I hear a couple of questions there, really good ones. I think the answer to your first question, is it the most challenging part of the challenge? It really depends. I think it depends on whether you already have a clear idea of what your proposal is, what your innovation is, which would then make it easier to sort of maybe identify a list of potential CBOs. Again, some people may already have working relationship with a community organization. So it's going to really depend. We try to help support students who, in the past, this has happened, where people had challenges finding the right CBO, and we encourage early discussions and efforts. If you don't have a starting community organization at the time that you're developing your idea, if you don't have a community organization, we encourage you to start that early in the 15-week program, because it takes time. It takes time to develop relationships. It takes time to ask the questions, to find a good match. I think there's a lot of learning in that process, even though it can be pretty intensive. Again, depending on what your idea is. And I'm thinking about last year, we had a student who had some real challenges, and I think queried at least 2 or 3 different organizations before landing on the right one, and then actually ended up being one of our winning proposals. So it can be done. It may be challenging, might be a really great learning opportunity if you don't have a history of working with community-based organizations. I think part of some of the takeaways we've had from previous years is that is often missing in a student's resume. Some students are coming straight through from undergraduate to graduate programs and really haven't had necessarily work out in community organizations prior to this. Some students are coming from disciplines where community organizations aren't really even part of the discussion, right? We have applicants who come from business schools and journalism, and they may or may not have a community organization framework. So a lot of it is going to depend on where you sit and who your mentors are, who can help you with this. Maybe this is an example of a place where finding a mentor who's got a good handle on community organizations in the area you're interested in might be a good step, if you're not coming in with one in hand already. Anyone, AJ or Tiffany, want to add to that? It's okay. Follow-up questions on that? Or any other topic? All questions are welcomed, because every time you ask one, you remind me I forgot to say something I should have said in my remarks. Please ask away. Maybe I can ask the audience a question. Has anybody gone to look at the application portal yet? See some thumbs up, at least. Just wondering if there are any questions, functional questions about that. I also want to say, I don't know from looking at your names what departments you're associated with. You could be from any department or school on campus, because we've been spreading the word broadly. I want to just make sure if those of you who are not necessarily in public health or medicine or public policy, I want to encourage you to, I'm glad you're here, first of all, because as I mentioned, we really want to encourage thought and solutions that come from different ways of thinking. So we're not discouraging health professions. That's not what I'm saying either. But sometimes because your curriculum may not have like prepared you for this kind of thinking. You might go, oh, I don't know if this is quite right for me. Again, this is why we have a program. This is why we have some workshops. This is why we have resources, and why we make sure you have a mentor to help you with this process. And the fundamental thing is having a connection to this topic, a real passion to want to drive positive change for communities and people that are underserved, and to think about health very broadly, because we know that health doesn't just happen in a clinical encounter. The majority of health happens outside of a clinical encounter. It happens in communities. It happens in housing. It happens in whether people have access to food, whether they have clean water to drink. It happens in how they're treated, in their jobs. It happens based on opportunities that they have or don't have. So these are things that we all can think about, and we can all dream up solutions for. And if you're coming from a different discipline or department, please put it on paper. This is a 2-page application. I don't think it's too demanding. And it's just the proposal for the full proposal, right? So if you can communicate an exciting, innovative idea, whether you're in already kind of more connected through in your training to health, traditional health sector work or training or not, I think that's the key. You want to communicate in this brief application why your idea has legs and could take off and become something. And then in the 15-week program, you have time to put all of that, to build that idea out with the support of our team here, and with the support of the mentors that you enlist. And so I encourage you to be courageous that way. I think it's an exciting opportunity. I'm a little biased, easy for me to say, right? But hopefully I'm communicating an idea, especially if those of you are like a little skeptical whether or not this really applies to you. It does, because I think we all connect with health, right? We live in our bodies. We know what it feels like to be healthy, and we know what it feels like when we're not healthy. And we have family members, and we see people go through different challenges, and we live in different communities. So this is really, want you to think big, and then bring a specific idea to this application. And we'll go from there. The independent review committee will review those ideas. And I see somebody's weighed in. Okay, thank you for sharing where you're from in law school. Great. Awesome.
It looks like we have 2 more questions in there. One being, are you able to submit an application with another colleague or peer?
Yeah, this question's come up a couple of times before, and we really have designed this to be an individual student challenge. All the work and the ideas inevitably are going to involve collaboration, but for this program, it's really designed for a single applicant. Maybe you can enlist others to be, secondary mentors to help support and build your ideas, but we really just have we can only support one student at a time. Thanks for raising that.
And then the other question is it a hard word limit? I believe that's probably asking about the application.
Oh, yeah.
The proposal.
Yeah, those are just guidelines. I'm trying to remember if you get cut off after a certain number of words in the fill-in boxes. I don't think you do, but you're not going to do yourself a favor if you write a 10-page application for a 2-page request. So I think the word limits were really just set up there to help you get within that 2-page suggested length, because our review committee has to review these, select from them to go to the next stage. So you your 10-pager won't get reviewed. I mean, it'll get stopped after 2 pages, if that makes sense. So yeah, to answer that question, the word length are guidelines, a way to get your application to be close to 2 pages with what we think is the kind of the right amount of real estate to dedicate to each question that we ask. Hope that helps.
We also have a question, I believe from a community organization, how or what can orgs do to connect? We are in San Bernardino County and San Bernardino City.
Oh, so we have a community organization on the webinar. Great.
Yeah.
Welcome. You're a critical part of this process. So what we do is we have sort of a working roster of community organizations. We don't put them forward as a go-to list of organizations, but we have them internally in the event that students come to us and say, you know, here's the idea I'm working on, really trying hard to find a community organization. Is there any guidance you can provide? So we have that, and we're continually building on that list. So be happy to take the information about your city organization entity. We love the idea of programs being implemented out in San Bernardino, along with Riverside and LA. So we can absolutely, if you send us, you can email me. My email's on these materials right on the screen right now. Email me information about your organization. So, but just to be clear, you know, the student leads this, and then we just support where they go. And so having a sense of organizations that are interested in being connected with the student, that's very helpful for us and for the students. Did you say there was a second question, Tiffany, that
It was
I
a
missed?
similar question. Somebody asked if we do matching. So if a community organization is interested in working with a student, how they would go about doing that, but I think you answered that question.
Oh, okay. Great. Yeah, I'm toggling between chat and the Q&A box, so I'm not getting all the questions at the same time. Okay. I encourage everyone to take some time to look, if you haven't already, look around the healthequitychallenge.com website. You can see a lot of information that Tiffany and her team has really skillfully provided there about their experiences, their blogs, the community organizations that have been awarded before. I think that you have to come in with your own idea, but I think that the website will give you an idea of the range and the diversity of the ideas that have been proposed before across the board, whether they were the last selected 4 or 2 or not. A lot of great work, great ideas by very talented students. So again, so pleased that you have all logged on today to learn more about this, and really look forward to receiving your applications. I think maybe there's another message coming in. Maybe just thank you messages. There's another specific message. Let's see. Okay. Okay, great. Okay. I see. I think those were covered already. And some direct requests, following up on my request for people to send me specific information that are around community organizations. So thank you for that. I will follow up directly. Other questions or comments before we wrap up? I think we are coming close to the top of the hour. Oh, I guess, if nobody's asking, if there are other questions, Tiffany or AJ, that you see, you'll tell me to be quiet, right? But for the meantime, I just want to give a shout out again. I mentioned this before. I think that our Center for Health Policy Research is so unique in that we are set up to really translate research to practice to policy. The idea is really to connect with the real world. And this program is such a wonderful reflection of that. And part of that is the communication. Such a big part of that is the communication. So, going back to the idea of writing blogs as part of this program, that might seem a little foreign for some of you if you've really been steeped in doing a dissertation and, computating, multivariate analyses, and you're like, well, why would I write a blog? But I also know you're here because you've read that this is about community health at some level. And so part of translating your research skills, clinical skills, your professional chops into a language that's well received and can really have more impact is learning the skills of how to write a policy brief or a fact sheet or a blog, and using other forms of communication. So I think about this program and the communication piece that is part of it. Again, I mentioned the poster development as another, that's maybe a more standard academic exercise. And yet you're going to be developing a poster that's really talking about a program, not about your research results, because this is about developing a program. It's before the program's been implemented. So it's at a different stage of the process. And I think that some of the feedback we've gotten from others who participated in this program before is that they found great value in those opportunity to build those skills. So just wanted to kind of give a shout out to that. And I think the other high level feedback that we've heard from others is it's an opportunity to kind of apply what maybe you've been learning so far, mostly in the classroom, and make connections in the real world, which are going to help support your career following graduation. So all of those things, just to say that I think there are pieces in this, if not multiple pieces in this, that can be of great value. So really appreciate your being here, learning more about the program, asking great questions. And if there aren't any more questions for us, I think we can let you go and have a late lunch, or maybe you enjoyed lunch while I was chatting away. Either way. Last thoughts, Tiffany or AJ?
Well, I'm just really looking forward to reading your applications. You've got 2 weeks from today to get them in. So let us know if you have any questions.
Same here.
Wonderful. Thanks, everyone. Look forward to your applications.